Welcome to We Help You Home, the podcast where we explore real stories, expert advice, and practical tips to help seniors thrive at home. Whether you're a caregiver, a family member, or simply planning ahead for your own future, we're here to guide you through the journey of aging in place with dignity, safety, and the support you need. I'm your host, Rob Steinbrook, and I'm glad you're here today. Today we're joined by Valerie Smart. She's a licensed registered nurse with many years of experience in geriatric care. Valerie has worked closely with patients and families that are navigating memory-related challenges like Alzheimer's and dementia, and she's passionate about creating care plans that support both physical safety and emotional well-being at home. Valerie, thank you so much for being here today.
Thank you for having me. I'm excited to be here.
Valerie, to start us off, could you share a little about yourself and what led you into this field of nursing, especially working with older adults?
Yes, I started my nursing journey actually in high school. I started the health sciences classes back then. I have been a licensed nurse for about 13 years now and have worked with all age groups since then. However, I really developed the passion for home health involving older adults while helping my grandparents transition through life. As a family member, it adds an extra layer of challenge in helping them, but it helped me learn a thing or two about assisting our patients and their families with these changes and helping them find joyful moments in the journey.
As we approach this subject of memory loss, I immediately think of people that I've met and people I've known who have walked through that valley of life. People like Beulah, who was somebody I knew that when she started struggling with memory loss would write down the time continually, and she would carry a notebook with her and write down numbers and write down dates and was continually writing to try and help manage the situation. I think about people that I knew that were in assisted living centers, in memory care units, who would continuously walk, and they couldn't be still, and some that would even become violent at times and would lash out. One gentleman I knew that was a very kind gentleman, never knew him to say a curse word or do anything out of line, and as he battled memory loss and as it increased in his life, he became very violent and very hostile, using profanity and things that just was really out of character for him. Now, there's a lot of terms thrown around for memory loss, terms like dementia, Alzheimer's, mild cognitive impairment, and these different names. Can you help us understand what these conditions are and how they differ?
Yes, dementia really is a broad term for the changes in one's cognitive functions. This includes both the mild cognitive changes as well as cognitive changes that have progressed to impair one's ability to care for themselves. Mild cognitive impairment is the early stages of memory loss, but where one might still be able to perform their normal daily activities without much impairment. This stage often goes unnoticed by others or is noticed but overlooked due to what we might consider limited inconveniences. But the signs are there. You'll notice the way a loved one is processing information might be different than the way they did it in the past, or they might start forgetting smaller details. These minor details should still be mentioned to the doctor. It's not always what someone might call normal parts of aging. And then as far as Alzheimer's, this is the most common form of dementia. It's very noticeable because it's affecting someone's memory, the way they're thinking, the way they're behaving. Early symptoms of Alzheimer's can include mood changes, increased confusion, or repetitive behaviors. Many people describe it as their loved one telling the same story over and over in such a short period of time.
And you've touched on some of those early warning signs, and it seems like a lot of times those that are closest to the person struggle to recognize it when the early signs pop up. It's more about somebody that pops in that hasn't been around in a week or so, and they're like, wow, you're not doing so well. And it's those that live around them on a continual basis that sometimes don't notice at first those early signs. What are some other early signs that you could think of that we should watch for?
So early detection is very important. Families should report even the mild changes as soon as possible. The sooner these changes are caught, the better. During the mild cognitive impairment stage, the individual may just become more aware themselves of their memory difficulties, like missing an appointment or not being able to follow a conversation as well as they used to. Sometimes it's not being able to remember how to get to a place that they're used to going to, whether it be the grocery store or church. And they may joke about the situations or mention it to a family member just in passing. And if your family member has mentioned situations like this, it's not a bad idea to accompany them to their next doctor's appointment. The patient and the family will always be the best advocate for the situation. I remember sitting in a pre-op appointment with my grandfather, and the nurse walks in and mentions CHF in all of the discussions preparing for his aftercare for his surgery. And I let her continue her spiel. And then after she left, I turned to him and I said, "You have heart failure?" And he said, "No, they must be talking about something else." Well, when his cardiologist came in to talk to us about the procedure, I had mentioned something to the cardiologist, and the cardiologist turned to my grandfather and said, "Yes, we've been talking about this over the last several appointments." So while dementia is a cognitive diagnosis that affects your brain and your memory, because it affects your memory, it can then have an impact on someone's whole entire health, not just their brain. So if caught early and you notice these early symptoms and you go and talk to their doctor and advocate for them, early testing, diagnostic testing, and treatment can help slow the progression of this disease.
Yeah, that's very important, isn't it? Sometimes people want to just ignore things, but really that does more harm in the long run. But when someone is experiencing memory loss, it affects more than just their memory. It impacts their safety, their routines, and relationships. What are some practical ways caregivers can make the home safer and more supportive for someone that's facing memory loss?
Safety is a major concern as the disease progresses. Mild cognitive, as I mentioned, can be considered minor inconveniences, but this stage is the most important to start implementing the safety behaviors that might resonate with your loved one later on. One thing that we suggest any patient on aspirin, whether dementia or not, they switch from regular razor blades to electric razors. For someone who has dementia, it's best to catch it during those mild cognitive stages so that they might remember later on, like, oh, I need to not use that regular razor blade. It's also important not to have those razor blades available for shaving. Now, it might not work. They might not remember. Like I said, just not having the razor blades in the home, the critical thinking and reasoning will start to decline. So finding ways to prepare meals without a stove or an oven, also putting signs over those appliances like stop, don't use. We actually in our home removed the stove knobs so that my grandparents couldn't use them unless we were in the room to help monitor the situation. Smart plugs to control devices, like our electric kettle was metal, so if my grandma went to touch it, she would have burnt her hand. So we plugged it into a smart plug, and then she would come and say, "I can't get this darn thing to work." And so it was our safety measure to make sure she'll come and get us and we'll help her. And we still tried to make it to where she was independent in tasks like that, but safe. If you have steps inside your home or getting into your home, marking them. You can get bright colored painter's tape for the steps inside your home, and cover the entire step. Don't just cover the little area where they usually step over. Make sure the whole entire step is covered. And then they have concrete paint for outside steps that does reflect even in the moonlight. Removing rugs, cords. Oddly enough, mirrors can confuse dementia patients. They don't have that perception of what's real and stuff. So if you can leave the mirror in their bathroom, or if they're used to a mirror in their bedroom that they were getting ready in the morning while using that mirror, you can leave that one. But if you have decorative mirrors like in the hallway, it's not a bad idea to remove those. It just helps with the confusion process. Lower water heater temperatures, and then make sure all the faucets are clearly labeled hot and cold. to cut down on possible burns. If you have glass doors, apply decals that are at your loved one's eye level. So they know, because again, their perception is not there. And so they know, oh, there's something here. I need to open it to get through it. Make sure pathways are well lit at all times and clutter free. Buying just little night lights that can plug into the walls that don't create a big bulk that might become a tripping hazard. And then something that I learned recently from one of my patients is, well, we all know fire detectors need to be tested regularly. Batteries need to be changed regularly. If an elder or an older adult is not able to test their fire detectors or change their batteries, whether they have dementia or not, they can call their local fire department and they'll come out and change the batteries for them, test all the smoke detectors for them. And if you have a loved one, even if you're not living near them, call their local fire department and they will go out there and test them all for them. I thought that was pretty cool.
Wow, that's great information. All that's great information. And your experience working with patients as well as your own family situation has been a real learning experience for you. And I appreciate you sharing that. That's stuff that really benefits the rest of us. So how can families manage the emotional side, like frustration, confusion, or even personality changes that come with memory loss?
So frustration and confusion, emotions run high all the time. It's natural to feel this way as you remember what your loved one was once capable of. I remember one of my least proud moments while helping my grandmother through her journey. She was upset with my son for leaving an 88-cent cup at the neighbor's house. Naturally, I'm telling her it's not a big deal. I can just get it tomorrow. I can buy a new one. It's 88 cents. But this situation escalated because she didn't have that reasoning. She didn't have the critical thinking skills. Looking back, which is always easier for us to do, to judge the situation in hindsight, I now understand. She grew up in the Great Depression where not even a penny could be spared. And I'm sitting here in 2019 thinking it's just 88 cents. I can replace the cup tomorrow. To help these situations, it really is crucial for family members to take a step back, take a deep breath, and if it's not a safety concern, if it's a minor situation, just go outside and get the cup. As far as helping loved ones during the journey to limit confusion, it can also help limit the frustration of the family members. If you have a large print clock that also displays the date, the day of the week, etc., so the loved one is constantly aware of time and date, that helps. Having pill minder boxes with a timer, they have some great ones out there that actually have the timer color coded to match the pill box time. And then the timer will go off and it will display the color of what pill box they're supposed to get, whether it's AM, noon, PM. And so that still allows the loved one to have a sense of independence while the family members are also maintaining that safety. It limits the confusion. Having daily schedules written out or typed out so that your loved one knows what to expect throughout the day will limit the confusion. It will also limit the caregiver's frustration because it will limit possible behaviors from the confusion from your loved one. Having the emergency contact information for everybody clearly posted near the loved one's phone or on their fridge. Removing old newspapers or magazines. A lot of times these are overlooked, but if your loved one has a magazine from 2005 sitting on their nightstand or their coffee table, they're thinking that their granddaughter's about to graduate that year, and it's sitting here 2019, and I'm already out of nursing school. It's well past that time. And that's something a lot of family members will overlook. Oh, it's just a magazine. Oh, it's just a newspaper. She keeps that for the clippings because that was her favorite team or it was important that day. And it just adds to, while it's nostalgic, it just adds to confusion. Creating a menu board for the meals of the day. Also try avoiding meals that need to be heated variety of sandwiches, chicken salads, fresh fruits and veggies, so that your loved one doesn't attempt to use those appliances. That will also limit the frustration, because the loved one is going to try and let me heat up my meal. If the loved one is ready to eat before you're available to make their meal, they're going to try and use the stove or use the oven without your help there, without your assistance. So if on the menu board it says we're having turkey sandwiches, they're going to say, oh, I can go to the fridge and make my own turkey sandwich. They're not going to attempt to put themselves in danger. And lastly, when creating those routines, when creating the menus, try and stick to routines that they knew before the onset of the dementia. So if Monday was laundry day, make sure on your schedule you put, we're washing laundry today. If Tuesday they always went out for breakfast, make sure you try and stick to Tuesdays we're going out for breakfast. This will also limit the loved one's frustration, loved one's confusion, as well as limiting your own in that whole process.
Wow, it's a lot of great information. And you mentioned some things that I'd never heard of before. One of them was that the pill bottle, the pill manager item. Is that something you can get at your local pharmacy, or where do you get that at?
We got ours off of Amazon, and it was a 31-day pill box, and you can just take out the day, and they're clearly labeled 1 through 31. And on one side it's green, so that means it's not that day yet. And we take that out, and it actually sets on the timer. And then you can set the timer to 4 different settings. And it was morning, noon, dinner time, I think, and then bedtime were the 4 options. And you can set the timer, and it would go off, and it would light up the morning. And then when you put that little pill minder back in, you flip it to the other side, and it's red. So it showed that she already took it. And it wasn't expensive. It was actually relatively cheap. The timer annoyed her, though. So.
That's great information. And even about removing magazines and things. I mean, how many of us have old magazines around our house, especially those of us from a generation that used to get magazines in the mail? We generally hold on to them for a while. I could see where that would be confusing as well. So thank you so much for that great information. Caring for someone with dementia can really be exhausting, mentally and physically. What advice would you give to caregivers that are trying to balance compassion with their own mental health?
So your own mental health is very important for your loved one's health. If you're not healthy or in a good place mentally, you will not effectively be able to take care of anybody. It's not a sign of weakness to ask for help. It is actually a sign of strength and self-awareness. Something you can do as your loved one progresses is reach out to your local churches, community groups, or other family members. You can even ask your loved one's doctor for help. Many churches and community groups can provide volunteers to sit with your loved one while you take a break.
And sometimes we see that as the loved one slips further along in this disease, we see where they'll unfortunately forget even their family members, who they are at times. What advice would you have for a family that finds themselves in the situation to where they're no longer really being remembered?
So watching this stage of dementia is especially hard as loved ones forget their own family members, people they've known for decades. I have seen many families put together photo albums or books with individual portraits with the person's name clearly labeled, and then explaining who that family member is in the family tree. So you can have a picture of John and say, this is your son. He was born here. He is now a pilot. And then next to his picture, you can have a picture of Jane and say, this is John's wife. They were married here. She stays home with their children. And then list their children. This is little Johnny. He was born here. He's John's first son. He likes football. And then Janie, little Janie. She was born here. She's John's second child. She likes to dance. And then you have a family portrait of them at maybe an event that your loved one was at. So this was Christmas in this year. And then list in order the people in the photo. So left to right, John, Jane, little Johnny, little Janie. This is one of my favorite things to see in a loved one's home. I have many patients that will pull out their photo album and tell me stories about each photo, tell me each family members and things they remember from years ago. And then photo albums are a universal tool, not just for dementia patients, but for everybody. Like, it's very common to see that in any family home is a photo album. So this is something dementia patients will understand even in their late stages of dementia. They know what a photo album is.
So scrapbooking, photo albums, things like that really make a difference.
Yes.
Can someone qualify for extra help like home health or hospice when facing memory issues? And if so, when is it time to consider calling in home health or hospice?
So I had briefly mentioned talking to your loved one's doctor, especially if you're needing assistance. Home health is a great resource during the early stages of dementia. We can help come in and educate your loved one as well as the caregiver about the early onsets of dementia and the things you're going to experience as the disease progresses and how to manage these changes. A home health nurse can come in and help set up pillbox systems, educate on home safety and the medications. The nurses are a great tool to facilitate conversations between doctors as the progression of the disease continues. We are huge advocates for these patients. On home health services, you can also have a therapist come in, either speech therapy, physical therapy, occupational therapy, and they can help slow the muscle deterioration. It's not going to stop the deterioration, but we can help slow it and help the patient adapt to these changes. A home health aide, if the insurance allows, can help educate on the self-care changes that need to happen as the disease progresses as well. Usually the insurance will limit those amounts of visits for the home health aide. However, if one qualifies for hospice, usually in the later stages of dementia, an aide can come weekly, more frequently if needed. They can help with assisted baths, self-care. They can also help with bed baths once the loved one becomes bedridden and unable to walk. A nurse comes weekly and we can arrange for volunteers or respite care to provide the family with those breaks that are needed for their mental health. We have chaplains and spiritual support, social workers, and bereavement services for after death. As for when to initiate the home health and hospice services, these services can begin as soon as it becomes a taxing effort for your loved one to leave the home. Mild cognitive impairment is that moment. There's no clear deadline when the disease will change from what I've been calling minor inconveniences to your loved one is now lost and we're sending policemen to find them, silver alerts, and all that. So early detection and reporting to your doctor is key for testing, treatment, and education's sake.
That's a lot of great information as well. Mm-hmm. And so many people that are struggling don't realize there's help available, and your insurance can provide for some of that. So be sure to ask your doctor questions and be an advocate for your loved one to try and get them everything that they're entitled to, really. I recently read where there's different kinds of studies that are taking place that are helping Alzheimer's patients, and I saw this one news article where there was a couple of cancer drugs that they found that in clinical trials that is actually helping with Alzheimer's patients, and it's looks like it's even reversing some of the damages, is what the article had said. And then I saw another one that said that if you eat eggs once a week, it could reduce your risk of Alzheimer's by 35%. And there's a lot of things like that who knows how to prove, but there's a lot of productive studies that are taking place. Mm-hmm. And I know that there's groups like the Alzheimer's Association. They've got a website, alz.org, that has a lot of resources, helpline that's available as well. There's a phone number listed on alz.org that you could look up as well and call. They've got support groups and some of the latest educational materials as well. I know you've worked with a lot of families over the years, and when you think about the families you've worked with, could you share a story, without naming names, of course, of a family you observed that's cared for their loved one with memory loss? What are some things that family did well?
So the family that comes to mind is the one I based most of my examples from today on. They asked the community for help. They utilized the respite care while on hospice. They created the photo album to help with the confusion and the frustration. They created a safe place in the home for that autonomy, that independence, as long as the loved one was able to practice that. They prepared the meals ahead of time. They had lots of different snack options and meal options that didn't require appliances or safety risks.
Thanks for sharing that. And the things we can learn from other people is very valuable, and how they handle things well. But it's also beneficial to learn from the mistakes of others too. And it's often said that it's best to learn from the mistakes of others because you won't live long enough to make them all yourself. What are some things that a family didn't do well that you can think of that maybe we could learn from?
So I'm not going to discuss one situation just because we've all experienced those difficult moments and we didn't always act appropriately. And if I list examples, every person is going to think that I'm talking about them, and that's not the case. I will say, don't take away their abilities prematurely. That's going to increase the confusion and the frustration and the behaviors. They have the knowledge and they have the experience. They're just having a hard time expressing their wants, their needs, their desires. They don't know how to communicate it anymore. And it's, again, going to increase that frustration and ultimately the behaviors, in which case we then label them as a danger to themselves. And while that is true, it's mainly because they don't have that capacity to communicate well anymore. So as you go, look back on the way you have reacted in a situation that has not turned out the best for your loved one, and alter what you're doing. Provide the safe options, provide the safe way of doing things, adapt to the changes, learn from your mistakes, and it will lessen the confusion. It will lessen the frustration. Ultimately, it could improve the behavior changes that you're seeing in your loved ones.
Great stuff today. And I mean, I've been thinking about the stuff you gave could be something you could sit down and just outline and use as a sheet even for people that are facing these situations, a sheet that they could check off and make sure they're doing. And you brought a real wealth of experience today, so thank you for that. And thank you to each of you that have listened today and tuned in today to We Help You Home. If today's episode helped you, please share it with a friend, like it, subscribe, and tell others about the podcast as well. For more resources, you can visit our website, atexhealth.com, or check out alz.org for more information on this subject as well. And remember, you're not alone on this journey. We're here to help you home.